Good morning, everyone. As Gabrielle stated, my name is Peter Gudaitis. I'm the Executive Director of New York Disaster Interface Services, for those of you that don't know me. Gabrielle Sclafani, our manager for the Faith Sector Community Preparedness Program, will be our primary speaker today, as well as being joined by a colleague from the Health Department. She's being supported by Susan Polewski, who's managing our Fund for Public Health in New York City contract on COVID education. And I certainly want to thank the Interface Center, represented by the Reverend Dr. Chloe Breyer, who's on. Chloe, you can wave so everybody can see who you are. And the Mayor's Office of Faith and Community Partnerships. I don't know if anyone is on from that staff or not. But Dominique Atchison is just leaving as their executive director and going to the First Lady's staff as her faith community liaison. So we appreciate their support as well. I just want to touch base on a few challenges that we continue to face as the faith sector. One of them is a lack of vaccine, which I'm sure you're all very aware of, and vaccine inequities, which are also a major challenge facing New York City, where vaccines are available and whether or not the communities where those vaccine centers are the ones getting the vaccine, or it's people coming from outside of those communities. So part of our challenge as we face the remaining months of the pandemic is vaccine confidence and uptake, as well as the reconstitution of public worship and face-to-face programming in houses of worship. So how we approach safe worship together, as well as other congregant activities that congregations rely on to maintain community connections and emotional and spiritual wellness. So this guide is partially sharing tools for how we prepare for pandemic in general, but also asking us to take a hard look at how we reconstitute our work together and our work individually with the communities that we serve. And that includes our worshiping members, our devotees, as much as it includes the public that we serve through our social service programs. When we look at the role that faith communities play historically in any kind of crisis, it is faith leaders who are often turned to for advice by members of our congregations and our staff. And so there is a critical role that we play as risk communicators to our congregations and to the communities that we serve, and having accurate information on the vaccine, helping build vaccine confidence, is not only appropriate for us as community leaders, but it's also essential to safely reopening religious institutions and public worship. Without herd immunity, without confidence in the vaccine and people taking the vaccine, we will continue to face significant challenges. When we look at the anti-vaxxer movement and recent polls that show a significant percentage of the American public having a lack of confidence in the vaccine, that has to concern us for some sheer mathematical reasons. In order for the country to achieve herd immunity, so somewhere between 70 and 80% of the public either having natural immunity from infection or immunity from the vaccine, and given the fact that just about 25% of our population is under the age of 18, we have to have almost universal immunity amongst American adults. That is a very high goal when about a third of the American public, adults, say they don't have confidence in the vaccine. Now that's for a lot of different reasons. They could be anti-vaxxers, they could be people for religious reasons who will not take the vaccine. They could have underlying health conditions that make the vaccine risky for them, or they could just not believe in the vaccine science and not yet believe enough people have taken it for them to want to take it. So how we model confidence in the vaccine matters, and that's part of what we're asking today, is that when faith leaders get the vaccine and where members of your family get the vaccine that are in high-risk categories, you share their experience of the vaccine so that people will better understand what the slight risk of reactions are, but also your personal experience. So I had COVID-19 back in March. I frequently share what that experience was like. And I can assure you I don't want it again. But I also share the experience of taking my elderly mother, who's in her early 90s, for the vaccine and what her reactions have been, because I think that helps normalize some of the reactions that people have to the vaccine as well. The other matter that we should also touch on is the emerging variants of the virus. And our health department partners can talk about that a little bit more. Suffice it to say, as you are aware, there are new strains of the virus emerging, and there are questions about the efficacy of natural immunity to some of those variants, like the South African strain. And there are questions about whether or not the virus will mutate further, and whether or not the vaccine will only protect us from some of the variants of the virus. There's not a lot of certainty here. There's often not a lot of certainty. I think what we're all being asked to do is utilize the best information we have at the time. And at the time we are in right now, the best science we have available to us is the efficacy of masks, washing your hands, social distancing, good airflow, and taking the vaccine when you're in an eligible category. And not second guessing the science and waiting for something more magical down the road, of which there's sort of no proof that that's coming. So we know what we know right now, and that's what we're going to talk about, what we know about right now. So with that, I will give you back to Gabrielle, and I hope that this is a helpful webinar for you as you lead your congregations through the remainder of the pandemic and the vaccination cycles that are ongoing and upcoming. So thank you.
Great. Thank you very much, Peter. I wanted to hand it over to Reverend Dr. Chloe Breyer from the Interfaith Center of New York to say a brief hello as our co-sponsor.
Thank you so much. And thank you, Peter. Just to underscore that I think it's a privilege to be partnering with NIDIS on this, because I think of any organization that exists in the state of New York, you all are the most aware of how critical incidents, be they disasters, diseases, how they affect faith leaders on the ground, and the questions that I, as a faith leader, may have when it comes to dealing with my community, myself, and my city when a disaster occurs. And Peter, what you've said just reminds me that this is a particularly difficult one, because there are so many variables that we as faith leaders and we as Americans are dealing with. Be it, you know, if only there were the question of those who rejected the vaccine. That was something we could deal with. But the problem is also we have the lack of availability on the other hand. So that's another variable. Then we have this, the question of the strains that may or may not, you know, be dealt with by the vaccine. That's another variable. And I think the fact that we as faith leaders aren't even on the governor's list of people eligible to be receiving the vaccine right now further complicates the matter. So I just really look forward to this this opportunity to shed, to hear and to understand a little bit of light that can be shed for us as faith leaders in New York on this tremendously complex situation that we're dealing with. So thank you for the opportunity to partner with NYDIS.
Thank you very much, Reverend Dr. Breyer. Thank you for all of your support throughout this process and those words. As we get started, I want to give an overview of what we'll be talking about today. The first part of the presentation is about the Pandemic Preparedness Toolkit for Faith Communities. And we'll have a brief Q&A section on the toolkit, and then we'll move into additional resources as well as resources about the vaccine, which is when we'll be joined by our representative from the Department of Health and Mental Hygiene to answer any questions you might have. We're going to start off with this poll question. Is your congregation or community using a written emergency plan during this pandemic? I've been really impressed with the responses throughout the webinar so far that the majority of faith communities do seem to be using a written emergency plan. And one curiosity that I have is whether or not folks wrote this plan specifically for the pandemic, or if they had had emergency plans, variations of emergency plans before. Okay, I'm seeing mixed responses so far. Right now it's evenly split between those who have a plan, those who don't, and those in progress. Okay, a couple more responses are rolling in. Great. Okay, so you should be able to see the results. You'll see that 45% of the folks on this call who responded do not have an emergency plan in being used during the pandemic, 27% do, and another 27% are in progress. So I'm really hopeful that for those who said no, that this webinar will give you the tools that you need to get started writing that plan, and especially for those who are in process or already have one, that it will help you to make that more comprehensive and to create the edits that you need. So the Pandemic Planning Toolkit for NYC Faith Communities was adapted from the DOHMH document that I mentioned, and it includes considerations for congregational stakeholders and structures for ritual and religious worship, as well as for congregations who provide social services. A great feature of the toolkit is that it includes easy-to-use workshops that help you to adapt recommendations for your congregation. So just an overview of where to find some of the important pieces. And here we have an example of a page. You can see that the blue boxes tell you where to find template documents that can help you create your own plan, whereas the gray boxes are for reference and they share other pages of the toolkit on the same topic. When we're planning, it's important that we start by describing our communities, and this usually can be divided into two groups: the leadership and staff, and the congregants, clients, and contacts. So leadership and staff would include you, as well as anyone who is employed on payroll and volunteers, whereas the congregants, clients, and contacts are the people that you serve and your partners, vendors, and contractors. A helpful tool as you're doing this planning is to make an organizational chart and keep it up to date. We have an example here of a synagogue as well as of a church and common structures that those facilities might take, but of course you can adapt this to your own needs. When you're planning communications for your leadership and staff, it's important to determine what types of communication are most appropriate. This can include continuity of operations planning, who covers which positions if somebody in charge becomes unavailable or someone with an essential function isn't on call that day. Delegation of authority, who is most qualified in emergency if key leadership staff are not available. Human resources policies surrounding sick leave and work from home have become really important, especially during this situation, this disaster. And now it's important that we're sharing information regarding vaccinations, as well as how are folks getting training during this time, both for pandemic specific trainings and regular trainings that might happen in a given year that might need to be moved online. It's helpful to provide personal and family preparedness information, as well as that essential hygiene information like washing our hands, covering our coughs, and wearing those ubiquitous masks. When planning communication for congregants, clients, and contacts, it will cover a lot of the same fields, but it also might include changes to services, programs, rituals, and worship, changed hours of operation, or new methods for delivering services. For example, what are the rules around personal protective equipment if there is in-person work happening? Information about the vaccine and hygiene, of course, and personal preparedness information, as well as government service locations like points of dispensing for the vaccine, any information about assistance like rent relief that the government might be providing, and information about our partner organizations and the kinds of services and work that they're doing at this time. After you've identified those two groups, it's important to decide which type of communication will work best. And this might differ depending on your organization and who you're communicating with. This can include things like social media and in-house posters for leadership and staff, as well as email and memos. For our congregants, clients, and contacts, websites and keeping our websites updated regularly is a really helpful strategy, as well as mass emails like through Constant Contact, or if we're working with people who aren't particularly online, good old snail mail might do the trick, as well as posting flyers in public locations within our communities. Our next poll question: what forms of communication have you used during the pandemic? You can check all that apply. Popular responses on this one over this series have included email as well as text message, which is closely followed by conference calls and social media. I'm seeing similar responses so far today. Okay, so 100% of respondents are saying that they use email, and that's closely followed by phone trees. Okay, a few more results are moving in. Okay, excellent. So as you can see, almost all respondents said that they've been using email during the pandemic. And then we have sort of a spread across the other answers, that we have a lot of people relying on social media, phone calls and phone trees, as well as direct conversations, which the question's a little ambiguous. That might mean direct conversations in person using distancing and personal protective equipment, or that might mean direct conversations via virtual means. It depends on what the rules and comfort level in your organization are. This page shows you some of the supplemental documents that are available in the Pandemic Preparedness Toolkit. When preparing these documents, it's important to keep in mind positive action steps, that we're using an honest and open tone, providing accurate information, making sure that that information is really clear by having coworkers proofread it before it goes out, using simple words or short sentences, and that we're avoiding any kind of jargon, too many acronyms, judgmental phrases. It's not the time for humor or for extreme speculation about what might come to pass. And as you're crafting this communication, we're always keeping in mind our audience, the purpose of the message, and in what format is this going to be delivered. This chart can also help you to organize this communication, especially when you're having multiple events happening at the same time, and it might be important to get the details out in a visual manner. And this is available on page 91 of the toolkit. Other templates in the toolkit kit include messages like get ready for COVID-19, if you're not feeling well, staying healthy, and changes in congregational programming. And these can all be adapted to meet your unique needs and include the specific information for your community. During a pandemic, the celebrations, rituals, and ceremonies, weddings, rites of passage, observance of holy days that your community ordinarily counts on will require creative and patient reworking. Plan ahead for how you will maintain as effectively as possible the required rituals like prayer, study, and worship that give meaning, structure, and dimension to your community life. While we're planning, it's important that we keep in mind essential functions, that we think about orders of succession as well as delegations of authority. So who has the power to put someone in charge of something that they aren't usually in charge of? Essential functions are those that need to be performed during or immediately after an emergency, whereas non-essential functions can be deferred until after the emergency. We also want to make a distinction between those and mission essential functions, which are those that are directly related to accomplishing your mission, and the support activities for those mission essential functions. Like I'll give you the example here of a mission essential function would be ritual life, and a supporting activity for that would be maintaining the items used for worship, such as prayer books, sacred texts, and ritual garments. So we need these items, but they themselves are not the service. And a deferrable mission or function might be providing religious education. A lot of congregations and other communities decided at the beginning of the pandemic that they needed to put off religious education for a while, and then may have come back online after several months with a virtual version of religious education. And a supporting activity that might be deferrable for that would be everything from maintaining class rosters to supplies to paying teachers. Other essential functions might include providing spiritual, emotional, and social support, facilitating prayer and worship, maintaining social services for special populations, rituals related to death and dying, other rituals related to birth and cleansing, as well as wedding ceremonies. And I'm sure many of you have heard at this point that New York is going to be getting more weddings online with slightly larger groups starting in March and April. So that might be a change for a lot of religious professionals in the coming months. Some disaster pandemic specific services that might be essential are promoting coping and safe practices among staff and those you serve, having disaster specific personal self-care practices, recruiting specially trained caregivers and volunteers, practicing reciprocity between faith communities to provide essential services. How can you share services to make sure that no one leader or organization is overburdened? And communicating risk. And when communicating risk, it's really important to offer timely, accurate information, which seeks to inspire, inform, and educate, that we're meeting fear and anxiety with empathy, reassurance, and calm, that we're dispelling any kind of rumors or misinformation that might be circulating, and that the community feels that they have your approval for safer alternative religious practices. Our next poll question: does your congregation have an order of succession or delegation of authority plan? This is one where I've seen a lot of communities already have this in place, and that often they had it in place even before the pandemic. I'm curious to see the group today, what your experiences are. So far, the majority are saying yes, they do have an order of succession or delegation of authority plan. Okay, the responses are rolling in. All right, excellent. A lot of folks have order of succession and delegation of authority plans, 88% of those who responded. And again, hopefully if you don't have one, or if you're still working on it, that this is something that you will have the resources to do by using the toolkit. So the chart on page 53 can help you create that order of succession in order to maintain essential functions. So this is an example for a congregation that has social services of what an order of succession plan would include. So we have the sacred music director here, and first you put the primary person who's in charge of that, and then you have 3 alternates. So it's not just one person who can take over responsibilities in case the primary responsible person becomes indisposed, but we want to have multiple alternates with all of their contact information in an easily accessible place. This congregation also has a feeding program, and we would practice the same for the feeding manager, that we have more than one alternate available. A special note about volunteers. Volunteers present unique challenges during an emergency. Many have regular paying jobs which they must perform. They might use their free time or time off to conduct their voluntary activities, and they may be unavailable to perform these duties even if they aren't ill during a pandemic, but because their regular job has more need of them because of the pandemic. This also comes into play with volunteers who might be parents and have childcare responsibilities that are taking up their time now that schools are partially digital. So if your congregation or faith-based organization relies heavily on volunteers, it's important to check in with them in the early stages of a pandemic or other crisis to communicate the following. Reinforce the message about personal preparedness and household planning, ask if they need assistance, and check on their availability to assist your congregation if and when needed. Has that changed? Are they in a high-risk category according to the Department of Health? Are they able to continue their work? And are we encouraging them to consult with healthcare providers if they have, with their healthcare provider if they have concerns? When planning for staff, prevention is one of the most effective methods available, and the following measures can help prevent a pandemic like COVID-19 from spreading through your staff. We can host campaigns that promote healthy activities and that provide as much factual information as possible. We can encourage vaccinations and healthy activities like hand washing and social distancing. We can also communicate clear expectations about what is needed from staff during a pandemic. Is it easy for staff to find out about things like sick leave and working from home? This is also a time when we might want to think about revising human resources policies that require a doctor's note, because this could create an unnecessary stress on an already burdened healthcare system. It's especially important at this time that staff are cross-trained and that it's clear who's in charge if there's a change in leadership or authority, as well as that staff are aware of any medical, mental health, or spiritual pastoral care that your congregation or partner organizations may provide, because this might be a time when there is particular need. When we're planning for continuity for worship and religious gatherings, it's important to consider the following steps, like canceling large events and worship services and planning for alternatives. Many of us have started using Zoom or other video software, recording video sermons, communicating via email, etc. If we are holding events in person, are we staggering or limiting attendance or physically distancing congregants? Are there rules about masks? Are there traditions and rituals that might need to be suspended during this time, like handshaking? And when changing or moving events and services, what is the effect on those with access and functional needs? Is the new location fully accessible for those with mobility challenges? If we have our services online, do we have descriptions of images for those who are visually impaired? Do we have subtitles for those who are hard of hearing? These are all important considerations to have in mind. Other considerations include those for religious foods and diets. There could be disruptions to the food supply chain that might make it difficult to get those foods, or maybe we want to host communion with our congregation and we don't have a way of getting the wafers and wine to them. What alternatives are available? It will vary depending on your community and your traditions, but it's important that we're thinking ahead. During a pandemic, as a religious leader, you will need to help those who seek your care to reflect on what happened, name and grieve losses, explore doubts and questions about beliefs, participate in commemorative events and healing rituals, and express emotions. There's going to be an added need for providing spiritual care to the sick, dying, and bereaved. You might see a need to deliver food, to offer rituals of healing, to visit the dying in hospital, and to help with mortuary arrangements, all while simultaneously dealing with grieving families. It's important to follow all recommendations from our local health department on how to protect ourselves while providing spiritual care. And if we're providing care in person, this will most likely include wearing personal protective equipment and practicing physical distancing. We should plan for changes to rituals related to funerals and burials. Gatherings are strongly discouraged or not allowed, and there may be a higher demand for these services. It's very likely that you're hosting a lot of smaller Zoom-style funerals right now with maybe a limited in-person portion, and that after the pandemic passes, when things become more safe, that people will want a memorial service at a later date that's available to a larger number of loved ones. So we're planning for increased demand. We're identifying alternative service sites and models. We're also offering lists of alternative religious rituals and services to help people maintain a sense of community. We're developing partnerships with other faith communities for providing essential social services or ritual life. We're altering rituals that require bodily contact or shared vessels, and we're planning for providing alternate community experiences. This can include developing alternate protocols to honor the wishes of the deceased and their families and to prepare bodies for those rituals, creating an alternate protocol for birth rituals, and it's important that we prioritize essential services. So when do we make the choice to temporarily suspend day-to-day operations and services like weddings and birth rituals in order to concentrate our resources on the sick, grieving family members, and congregants who develop special needs because of the pandemic, such as children who are newly orphaned or others who have experienced loss? Now we have the opportunity, you can either share in the chat or call out, whichever is more comfortable. How has your congregation adjusted your services and rituals throughout the COVID-19 pandemic? At this point, I'm sure most of you have a lot of experience making these adaptations, and we're really interested in hearing your best practices. Do you hold services over Zoom? What does religious school look like? How do you celebrate life events like births, weddings, and funerals? And what resources do you provide congregants to help them worship or practice rituals from home? All right, Kristen Gramberg shares Zooming for everything, a lot of Zoom. That's been my experience as well. I've also seen different communities experimenting with Facebook Live and similar technologies. I've heard some very creative options for a religious school in terms of keeping folks engaged. Brenda Berkman shares YouTube for services. The Interfaith Center of New York shares Zoom for Sunday services as well, and graveside burials. We're in a whole new world now, having all of our memorials and rituals filmed in a certain extent. This was for St. Philip's Episcopal Church, that response. Patrice Rule shares Zoom for everything and Facebook live stream for our main Friday night Shabbat service. Brenda Berkman shares Zoom for meetings and seminars. Great. Lots of Zoom. And if anyone wants to add resources that you might be providing congregants to help them worship or practice rituals from home, maybe you needed to assist folks in accessing the technology they needed. Okay. So moving on to the next piece, planning for continuity for congregations and households. Yep, I see a few more answers also. Lots of Zoom and training sessions also over Zoom. So people are still getting the training that they need. So in terms of planning for congregations and households, if a staff member becomes ill or showing symptoms of a respiratory infection such as COVID-19, it's important to give them time off or let them work from home. And if a congregant has become ill or showing symptoms, we need to request that they stay home and access congregational services from home. I also see another response to the last question about shortening the lengths of service to minimize time of potential exposure. That was a practice that I experienced when I was living in Germany over the last year, and it seemed to work in the sense that we didn't have any outbreaks, but we were also limiting, creating distance between congregants and asking people to wear masks at the same time. When doing congregational and household planning, it's also important that staff members and congregants who are ill get concrete information regarding how long staff or congregants should remain home based on guidance from the local health department. Making sure others in that household are also staying home when they're sick or if they're exposed to someone who's sick, and that they're following the rules from the health department for people who were exposed, that we're sharing important information like basic supplies to keep at home, and sharing relevant city, state, or government programs. For example, here in New York City, we have the Test and Trace Corps. Special considerations in terms of supplies and equipment include acquiring personal protective equipment, making sure everyone has the technology they need, and providing hygiene supplies, everything we need to clean up, as well as copious amounts of hand sanitizer and ritual items or materials that might need to be delivered for folks to worship at home. We also need to account for additional costs because none of the actions taken in the previous sections can be successfully performed unless you plan for the cost to your congregation or faith-based organization. Additional supplies, communications, overtime, or any other items or actions may have costs associated that your congregation or faith-based organization may be challenged to afford. So when making choices, consider the cost from each of those actions. Some costs may be one time only, others may recur on yearly, monthly, weekly, or even daily bases. And also consider income that your congregation or organization might lose during a pandemic. For example, lost rent or reduced donations can really put a dent in the budget. Before proceeding with any of the actions you identified, answer the following questions before making a purchase or taking an action. Does my staff need this to continue to function? Will not having this put people's health at real risk? Is my action or purchase based on facts? And will my community actually use this? An example I like to use is that early in the pandemic, Nidus had purchased a Zoom subscription with a webinar license that let you have webinars with hundreds and hundreds of people. And what we found is that that license wasn't really necessary for the types of Zooms that we were having, and we could get away with a less expensive version. Planning for continuity in terms of mental and spiritual health. This becomes particularly important during a pandemic as these can be times of high stress. We can encourage staff to look out for one another and provide emotional support during this type of situation. Consider instituting a buddy system where each staff member can be assigned or choose someone to provide dedicated peer, psychological, emotional, and spiritual support. This isn't a substitute for a clinician, but it can be a good option in our workplaces to make sure that people have someone they can count on. Consider the following self-care tips for you and your staff. Taking care of your body means getting enough sleep and rest, eating healthy, exercising as much as we can, avoiding drugs and excessive drinking and smoking. Taking care of our mental health, learning about normal and abnormal reactions to disaster, not ignoring our own emotions and knowing when to seek help. Taking care of our spiritual selves, make time to reflect, to meditate, to pray, find spiritual connection or community. Increasing your resiliency, do something that will help you regain a sense of control. Focus on your strengths and positive coping skills. It can be really easy to focus on the negative in a time like this when there's always something more to do. But what are we doing well right now? Reaching out. If you feel overwhelmed, reach out, express your feelings. Don't be afraid to accept help. Remaining active. Go back to your normal activities as soon as it feels comfortable and safe to do so. Managing your workload, maintain a healthy balance between your work and rest, take breaks and time off, prioritize your task, and reducing stress. Do things that we find comforting, like exercise, reading, or listening to music. Spend time with people whose company we enjoy, and practice stress-reducing exercises. The following actions might help your leadership to delegate when they're overwhelmed. You could work with a judicatory, a religious network, or partner. Consider a congregation that has a similar mission to share leadership, and combine activities in a way that allows leadership to share responsibilities and split their time. If your congregation or organization has other branches in different parts of the region or country, you might work with them to have leadership from a less affected area come in to help. This was an option in the early days of the pandemic when New York was hard hit before other regions. At this point, the effects are so widespread that this might not be an option anymore. And if possible, plan to have leadership work in set rotating shifts, allowing one member to rest while another leads. Further tips on recognizing stress and staying mentally healthy are available via NYC Well. And we will share this PowerPoint with you, so all the links will be easily accessible. It's important to practice self-care so that you can maintain your own emotional, spiritual, and physical wellness while you continue to serve your community. You can now share in the chat or call out, how have you been practicing self-care throughout the COVID-19 pandemic? And what policies or practices have you put in place to encourage self-care among your staff? While people are thinking about their answers, I wanted to return to some comments that came in from the last question. So Brenda Bergman commented that if someone becomes sick, shouldn't people be advised about available resources from the city and contact tracing? Absolutely, it's important to provide that information, and New York City does have really robust resources available. And anybody who becomes sick and tests positive should be contacted by a contact tracer. And Christian Granberg also shared that they began a plan to have some in-person meetings, but then they needed to backtrack, and that their nursery school, which has to be in person to provide daycare, is doing well with the protocols. So if you have an answer to your self-care regimen, I'm really curious to hear it, either through typing or calling out. And something I wanted to share is that walking has been one that I practice and that a lot of our participants have practiced, making sure that they get outside every day. Something also that helps for me is taking stretch breaks, making sure that my body isn't all contorted from sitting too much, that I'm able to stretch my muscles. And I invested in blue light blocking glasses to make it more tolerable to be staring at a screen for long periods of time. Brenda Berkman shared walking and snow shoveling. Ha, yes, I've been seeing a lot of snow shoveling going on, which is a really great workout. Susan shares going on walks and having regular phone calls with friends. Yeah, those can be spontaneous. Sometimes we have to schedule phone calls, but making sure we're connecting. Christian Granberg shares walking daily. She convinced personnel that she needed a full week off with no meetings or PowerPoint creation, Zooming with friends and family. Yeah, these are really, really excellent strategies for taking care of ourselves. All right, I'm going to move forward, but I encourage you to talk with your colleagues regularly about self-care, and destigmatizing this conversation is really, really important. Here we have some supplemental documents that are available to help you with the continuity planning and communications planning, just to show you an easy visual for what they are. And we have a chance for any questions that might have come up during this section of the presentation before we proceed. If you have any questions specifically to the toolkit, you can ask them, and we're now going to proceed with additional resources and vaccine information. All right, I'm not seeing any questions, so I'm going to take that as a green light to move forward. Some additional resources include the NIDIS website and social media. We post real-time updates on our page, both on Facebook and Twitter, and you can repost these anytime. I want to make sure everyone's aware of our How Alert system. It's our House of Worship Alert, which is a free crisis and emergency risk communication tool that's designed specifically for New York City clergy and religious leaders and others who make decisions in the faith sector. It includes information on how and when to share information with congregants, organizations, clients, and staff, and it can send information about life-threatening or urgent threats through emails, text messages, or voice messages, with the option for two-way communication. So recipients can complete online forms like damage assessments and submit requests for help during an emergency. And the link to register is here, so when you get the PowerPoint, it'll be easy for you to just follow that link. I want to make sure that you're aware of the Thrive NYC Pandemic Mental Health Toolkit, which the Interfaith Center of New York and NIDIS co-sponsored with Thrive NYC. It helps those who are struggling with the accumulation of stress, grief, and anxiety and other challenging emotions. It helps you to restore the balance between physical, mental, spiritual, and emotional well-being, to identify and mitigate some of the effects of stress caused by COVID-19, and to direct people to appropriate resources by providing a pathway for identifying and referring individuals to a professional mental health provider when needed. Refer, if it's beyond your expertise, making sure that you have the resources available to do that. Some tip sheets that NIDIS offers include self-care for religious leaders, disaster mental health, disaster and crisis spiritual care, continuity of operations planning, part of which is also included in the toolkit, risk communications for congregations, which of course we have in the toolkit as well. These tip sheets are available on our website in the resources tab. The Disasters and Religions app provides literacy and competency resources, as well as tools for disaster readiness, response, and recovery. And the NYC Frontline Essential Workers Hotline provides support information and referrals for ongoing mental health intervention. And it's free for all essential workers in emotional distress. The Disaster Distress Hotline from SAMHSA is an important resource to be aware of, as well as NYC Well, which has free confidential mental health support all the time in over 200 languages, as well as a crisis team on call. The National Suicide Prevention Lifeline, it's important to have this kind of information posted on our websites and in houses of worship and other community gathering places, as well as the National Domestic Violence House Hotline. There have been increases in reports of domestic violence throughout the pandemic because folks are at home more. There's also an isolation hotel program here in New York. This can be helpful for those who have COVID-19 but don't have the space or resources in their own household to socially distance from others. And it's also available for those who are living with someone who becomes sick and don't want to become sick themselves. I'm going to proceed with some updates about the vaccine, and then when our Department of Health and Mental Hygiene representative joins us, he can take over. As many of you probably know, 2 COVID-19 vaccines have been approved for emergency use by the FDA, and in clinical studies, both vaccines were more than 94% effective at preventing laboratory confirmed COVID-19 illness. And the definition that the CDC, that the FDA and these and Pfizer and Moderna are using for laboratory confirmed COVID illness means a positive test plus 1 or more symptoms. And that was 94% effective in people who received 2 doses of the vaccine without evidence of previous infection. This chart shows how any new vaccine is developed, approved, and manufactured. So you can see that we move from a very small phase 1 trial to a phase 3 trial in which there are hundreds or thousands of volunteers. And the FDA will license the vaccine only if it's safe and effective and the benefits outweigh the risks. Every batch of the vaccine is tested for safety, purity, and potency before it makes it into the distribution stream. Are the vaccines safe? They've gone through large clinical studies involving tens of thousands of people of various ages, races, and ethnicities. The Pfizer vaccine had more than 44,000 study volunteers, while Moderna had more than 33,000. And the evidence from those studies was closely reviewed by both the FDA and independent organizations. Here you see the racial demographics and ethnic demographics of the Pfizer study trial. The goal was to make this mirror as closely as possible the US population. They didn't quite get there, but it is one of the most diverse vaccine trial groups of any vaccine that's been approved prior in the US. The Moderna vaccine trial demographics were very similar, and there's no evidence that this vaccine affects different racial or ethnic groups in any different way. The gender demographics are here. As you can see, it was pretty evenly distributed between genders, and that the percent of participants who were 65 years and older mirrors relatively well our population demographics. You can't get COVID-19 from the vaccine. That's really important to note. The vaccine does not contain the virus. Instead, it teaches your body's immune system how to fight the virus so it can fight it if you're exposed. And researchers have been working on vaccines for coronaviruses for many years. So this wasn't starting from scratch, and that although mRNA has not been used in vaccines prior, it also has been studied for over 30 years in different types of treatments, such as for cancer. The following groups are eligible as of February 2nd. Healthcare workers, folks 65 and older, residents and staff in nursing homes and certain group living facilities, people living or working in homeless shelters or other residential programs and supportive housing, as well as certain frontline essential workers, such as first responders, teachers and school staff, daycare workers, transit workers, grocery store workers, correction staff, taxi and limousine drivers, and restaurant workers. Those last two categories were added after the fact. That wasn't right on February 2nd. I believe it was a week later. And beginning Monday, February 15th, the following people with underlying conditions become eligible, and appointments should start opening up on Sunday, February 14th. So you see there's a number of pre-existing conditions that would qualify you for a vaccine starting next week. The next phases will likely start in March and April and include other at-risk groups as determined by the state, other essential workers determined by the state, and then it would become available to the general population, most likely starting in the summer. The vaccine is free for everyone. If you have insurance, it might be billed, but you won't be charged a copay or any other fee. And you don't need to share your immigration status in order to be vaccinated. It's not a public benefit under the public charge rule. When you receive the vaccine, your privacy will be protected. There are strict laws in place in order to ensure confidentiality of your personal health information. To make an appointment, it needs to be scheduled in advance. You'll complete the New York State COVID-19 vaccine form. Then you'll schedule your appointment using the vaccine finder or by calling 877-VAX for NYC. It's important to note that the vaccine finder will give you information for where vaccines are being offered, and you might have to call individual sites one by one to find your appointment. And keep in mind to wear a face covering to your appointment, continue practicing all of those safety precautions. I see that Noah from the Department of Health has joined us. I'm gonna go through just a couple more slides that we have on the vaccine, and then I'll turn it over to Noah to answer your questions. Here we have an image of the vaccine finder where you can type in an address or zip code or just use the Near Me feature. And like I said, each vaccine site manages their own appointment, so you'll have to get on the phone or follow links in order to schedule your appointment after you go through the eligibility, after you fill out the eligibility with the state. And here we have the COVID-19 vaccine tracker. So these are the results as of yesterday of how many doses had been administered. You see over 1 million New Yorkers have been vaccinated, and of those, 244,000 have gotten both vaccines. And we have fewer than 130,000 vaccines on hand. They're trying to get the supply out more or less as quickly as it comes. Side effects can include soreness or swelling in the arm where you got the shot, headache, body aches, tiredness, and fever. They're usually mild to moderate and start within the first 3 days after getting the shot. Most commonly on the day after vaccination, and they last for 1 or 2 days after they begin. They're more common after the second shot and less common in older adults. If you do get side effects and they concern you, you can call your healthcare provider. And especially if they don't go away after a few days, or if the redness or soreness at the injection site increases after 24 hours. And after the vaccination, you still need to practice prevention measures. And that's because we're still not sure if vaccinated people could be asymptomatic carriers. So it's important to stay home if you're sick, stay at least 6 feet away from others, wear a face covering when outside your home, and wash your hands often. Also, the vaccines are not 100% effective. We still need to learn about how long protection lasts and the impact on transmission. Herd immunity means that enough people in a community are protected from the disease because they've already had it or been vaccinating. And when enough people in a community are vaccinated, it makes it hard for the disease to spread from person to person. There's not enough available carriers, and this can help protect those who can't be vaccinated, like newborns. The percentage we need to achieve herd immunity varies depending on disease and specifically the transmissibility of a disease, meaning that the more transmissible strain that's coming from the UK strain, could increase the number of people who need to be vaccinated or have natural immunity in order to achieve herd immunity. And so we don't yet know exactly what percentage of people would need to get vaccinated to achieve that. For this disease, the estimates we've heard are between 70 and 80%. We have the opportunity to unmute or share in the chat. Have you gotten a COVID-19 vaccine, or do you know someone who has? What was your or their experience? I see a question from Brenda Berkman in the chat, and I'm going to hold that for Noah because I don't know the answer. All right, anybody on this call has gotten a COVID-19 vaccine or know someone who has? We heard about the experience of Peter's mother earlier. I know a lot of healthcare professionals who have gotten a vaccine. One person, a doctor I know in Ohio, posted today that she was disappointed because her symptoms were so mild that she couldn't justify taking a sick day. She had been looking forward to binging on some Netflix, and instead she's going to work. Okay, Christian Gramberg experienced the range of symptoms as noted. Okay, and these are expected side effects of the vaccine. Okay, Brenda Berkman shared first doses arm soreness, except for the person who had the virus and got symptoms with the first shot. Okay. The Interfaith Center shared having gotten one myself, helped an 82-year-old get one with minimal side effects. And Beth Perry shared many people and no one has had any major problems I know of. That's great information. Thank you. And have you talked to your congregation about getting the COVID-19 vaccine? If so, what kind of questions are you getting? I would like you to be able to pose those kind of questions that you might be getting to Noah. So I'm going to turn it over now to Noah from the Department of Health so that you can answer any questions that folks may have had. And I will start with one question that's already come through, Noah, which is advising people about the privately developed site that tells people which sites actually are scheduling appointments so people don't have to visit each individual site. Noah, do you know about this private site that does that?
Hi, good morning. No, I'm unaware of the private site. The only site that I'm aware of is the vaccinefinder.nyc.gov, which allows people to be able to schedule appointments, recognizing, of course, that due to vaccine availability, the wait time is about 12 weeks or 3 months out. But if Brenda would like to elaborate further about the privately developed sites she's referring to, perhaps it might be able to jog a memory, but I'm unaware of this.
Okay, she wrote that it has been in many news articles.
Yeah, so I should preface this by saying I'm not a doctor, right? So I just want everyone to know that in terms of any actual medical Q&As you might have, my ultimate answer will always be, speak with your healthcare provider, right? And then in terms of the health department, the information that we're given in terms of talking points and everything that we know so far about the vaccine are things that are heavily curated and researched by the health department. So if it's not part of my my slide deck or my information kit, it's something that I'm unaware of. So unless this is something that is still under development and they are yet to actually provide guidance on it, that's probably what this is in terms of the privately developed site. But frankly, I have no knowledge of this so far.
Okay, so Beth Perry shared that they had used that app yesterday and gotten an appointment for Friday, and that others have also used it successfully. Unfortunately, they're also forgetting the name of the app. So this is a resource that might be available, but we're not quite sure what it is, I guess.
Right. So the only thing I can offer on that end is I'm aware that they're trying to streamline an app in order to make reservations much more seamless, and hopefully to be able to make it such that when appointments become readily available, you can see that clearly. However, again, so far from on my end of the health department, we have not yet been given clear guidance or talking points about this app yet. So again, my apologies that this would not be something that I would be able to provide information on. I feel like we just started and already the only things I've said so far is I don't know this yet and I can't provide information about this, but I assure you, I'm sure there'll be other things that you'll ask I'll be able to provide some guidance on.
Okay, thank you so much for those answers, Noah. Does anyone have any questions that Noah might be able to help us with today? I saw one person had commented that to beware of scams, that the vaccine is free. I don't know if you've encountered any problems with vaccine scams. Noah, if you're aware of that.
So on that end, the guidance for that is that if you do encounter a place that you feel like this is a scam, right? You should definitely report this. I believe there's a phone number for the Attorney General, New York City's Attorney General, fraudulent appointments that you can call. If it would be helpful, I can either post it in the chat for everyone to see, or I can send this afterwards to either of you so that you can share with everyone on the line. But there may be some, with the COVID virus and testing and vaccines, there are unfortunately opportunists who may be trying to take advantage of this, right? So the hope and goal is, should you encounter anything that feels fraudulent to you in any way, shape, or form, immediately notify the Attorney General's office, and there's a toll-free number. It's 833-VAX-SCAM, right? So 833-VAX-SCAM. And again, I'll post this in the chat once we're done. And that's a toll-free number you can call to report this. Keep this in mind, right? For all intents and purposes, the vaccines are supposed to be free. If you have insurance, wherever you go for an appointment, may ask you for your insurance card in order to be able to bill your insurer. You will not incur any costs. So you should not incur any costs, right? So if you go anywhere that they're asking you to pay upfront or have to pay for the vaccine, that's not something that you should have to do, right? So please, I would hope that everyone can keep that in mind. So again, if you are anywhere that someone is telling you that you have to pay for your appointment, pay for the vaccine, pay for any follow-up care, whatever that may be, that sounds fraudulent, that sounds like a scam, and it's 833-VAX-SCAM. That's the number to call to report that.
Thank you very much, Noah. Do we have any further questions about the vaccine?
Noah, is the city still having challenges with keeping enough vaccine available every week? Are you running out every week, or are we now sort of caught up and we don't run out anymore?
Yeah, so with that, I believe, I think as everyone is aware, right, the vaccines are coming from a combination of federal and state allotments to New York City. So what just tends to happen, in my experience thus far, is that the vaccines tend to run out, right? And New York City's general vision and goal every week is to be able to vaccinate all the people that have reservations, and that has generally been happening fairly consistently. but there have been times where some of the vaccines have run out. And because of that, you can see New York City has had to course correct. There have been multiple sites that would need to either close and not be open, reschedule people for maybe a week out due to the vaccine allotment. So the real ongoing challenge that we all know of is that there are not enough vaccines, period, right? That New York City's efforts are burgeoning, they are magnificent, but we recognize that the supply is severely limited. So that's something that the city is constantly working on to be able to get more of a supply and effectively vaccinate everyone who's been registered or has an appointment for vaccination. But there is the caveat. We asked our patients and that there will be times where the vaccines will run out. And even right now, as of today, the latest guidance I was given was that to get an appointment, you would have a wait list of about 12 weeks, so about 3 months before you can even get an appointment. So again, New York City's goal is to vaccinate as many people as quickly as possible, but we recognize that the supply from the federal government hampers those efforts.
Sure, thank you, Noah. Our next question is, what is the city's plan for hard to reach homebound folks who can't leave home?
I know that there have been discussions on this right now from an equity standpoint. I do not yet know what the guidance on that will be. I know that there are discussions about this and plans to effectively ensure that those who are homebound and can't make it to appointment sites are able to receive the vaccinations. I believe the hope is to be able to eventually develop something where they can have healthcare providers who will do this. But as of this date, to the best of my knowledge, I am unaware of where those plans currently stand. All I do know is that those conversations are happening, and I think something will be shared in the very near future regarding that.
Okay, thank you. Do folks have any other questions, either from their own side or that they've been getting from congregants and those who use the services of your organization about the vaccine? If you've been encountering any vaccine skepticism in your community. Okay. The Interfaith Center shares that yesterday I got an appointment for someone who is a home care provider for Monday. So she had used the Vaccine Finder site. So she was able to get an appointment much more quickly than 12 weeks.
And that's absolutely wonderful, right? So we, like I mentioned, the city has a plan to vaccinate as many people who have appointments due to when there are supply changes, right? Where it looks like there are enough vaccines, more appointments become available, right? And that happens on an ongoing basis. So we've heard from folk who have been trying to develop a system, right? A rhyme or reason to how you can get appointments. We've heard from some folk who say, you know, they waited until a Sunday, right? And looked for appointments on a Sunday or something to that effect. Some people said Wednesday evening was the best time to look and try to get an appointment. After a while, very frankly, it sounds almost like when you're trying to book the best ticket, right? When you're trying to find the best flight deal, you can look on a Tuesday night, Wednesday night. The honest truth is that these appointments become available at random points in time. So I'm very happy to hear that the Interfaith Center was able to get an appointment for one of their home care workers. And in order for that means that an appointment was just made readily available, right? But the general guidance though is that for most people who may be trying to get an appointment, the wait time may be somewhere in the range of like 12 weeks, right? Recognizing of course that different appointments will pop up here and there. Great,
that's good information. Our next question is, what is the plan for youth under age 16?
So currently, both the Moderna and Pfizer have trials that are ongoing, clinical trials ongoing to test the efficacy of the vaccine in youth who are under the age of 16, right? So until those clinical trials develop their results and they're able to publish and prove its efficacy, right now the guidance is that anyone under the age of 16 should not be taking the vaccine, right? Particularly for the Pfizer, right? The Moderna, I believe, is 18. It's 18 and above, and Pfizer is 16 and above. So anyone under the age of 16 cannot take it yet until those clinical trials have been completed.
Great, thank you. Samson So asks, what to say to those who think the vaccines are fake and refuse to get vaccinated?
So we recognize that people have various sentiments regarding vaccines, right? And to that end, what we can share is that these vaccines, currently the Pfizer, Moderna, which are in use, and even the Johnson and Johnson Janssen one, which they have applied for an emergency use authorization and may be readily available very soon. These are vaccines that were developed through rigorous clinical trials, evaluated and moderated by the Food and Drug Administration of the United States, right? We've heard concerns that, people have felt that vaccines normally take a long time to develop. But why was it that these vaccines were readily available within the span of a year, right? And because lifted a number of restrictions and made the path as clear and as seamless as possible in order to expedite the development of these vaccines. There weren't shortcuts that were made in terms of the vaccine efficacy. They were tested all across the world, both the Pfizer and Moderna, and the other ones that are currently in development. They had rigorous clinical trials, and they proved that they were effective. And that's how the FDA finally gave approval for them to be in use, right? So through the emergency use authorization. So as much as possible, regardless of where anyone may stand about vaccines, and we recognize that people may have their own sentiments about them, to the best of our knowledge, as much as possible, these vaccines were rigorously tested and have been approved by the FDA for use. So they've been deemed safe and effective, and that's the important thing as well. Safe and effective, all right, for use against the COVID virus.
Great. And Samson So, who asked that question, says thank you, and also commented that he's bringing his mom for her second shot today. She experienced tiredness and sleepiness after her first shot.
Right. And the symptoms have varied. We know that tends to be the case. So there's some achiness, there's some soreness. The general guidance that we've heard is, consult with your clinical provider, of course, if you have any underlying conditions or any allergies to certain medication. But generally, we've heard taking some sort of pain reliever, like a Tylenol, an Advil, and that's something to that effect tends to help with the achiness and soreness. But again, check with your clinical provider in terms of what to take to help remedy that. And we've heard some people who said the second shot, they didn't feel anything, and other folks who felt that it was really jarring and they had even much more pain. But it ended up, for the most part, everything that we've heard so far has been that the pain is temporary. The symptoms end up alleviating after a while, and people feel fine.
Great, thank you. One question we got from Christian Granberg is, what is the way to find out if vaccines that are thawed but not used become available at the last minute?
So there isn't a system-wide process where you can figure that out, right? Because that then would just make it such that anyone can not make an appointment and just try to figure out where there are remaining vaccines. What happens so far at every vaccination site is that, or almost every vaccination site, is that there's a wait list, right? So there are people who may show up who have issues with the appointments, or people who may show up who would like to get vaccinated but don't have an appointment, which is not recommended. The recommendation is to make an appointment. However, each site has a wait list. So invariably, there's some people who make appointments who don't show up, right? So if a site has some vaccines available at the end of the day, when you go and you don't have an appointment, you can request to be put on a wait list. And if there are vaccines available, you'll be given a call, depending upon how many vaccines are available, right? But that again is, that's up to chance, right? So it depends upon the site that you go to, in your neighborhood or wherever else you might go. And that's all. It's literally just it's really just by chance, right? So there is no system-wide way to be able to determine if a vaccine is available at any other site, other than just attempting to make an appointment.
Great, thank you for clarifying that for us. Are there any further questions that we would like to pose to Noah?
If I could comment on, I believe it was Brenda's comment about the private site. Is that possibly in reference to some of the pop-up vaccination sites that have come up from the governor's office? Is that what Brenda is referring to? Because if that's the case, we know that the governor's office has been working on partnerships with various faith-based organizations and cultural institutions to provide sort of pop-up vaccination sites, if that's what she's referring to. Oh, I think she mentioned the website here.
If I could just say, I put the link to the website that I was referring to in the chat. It's a private site that was put together by volunteers. It's not associated with either the state or the city's vaccination scheduling. It just shows places that indicate that they have vaccinations available and appointments available. And it's updated somewhere between every 10 and 30 minutes according to their site. So it might work for some people. It's like I said, it's a volunteer effort that was that has been profiled in numerous articles, news articles.
Okay, so I'm taking a look at it as we speak, and again, for all intents and purposes, this wouldn't be a site that I would recommend as a health department operative, right? That it would be vaccinefinder.nyc.gov. Again, if this is a grassroots, it sounds like this is a volunteer-led grassroots efforts by folk who are concerned about vaccine availability and are trying to get this information out to the public. If you feel as though this is something that works for you personally, and you're able to have success with it, then that's great, right? But that's not something, it wouldn't be a site in any way, shape, or form that I would be endorsing or recommending that folk use to schedule appointments at this point in time. Though we recognize that there are many valiant efforts in place to try to bring about greater awareness of vaccine readiness in different locations.
But the Department of Health understands the frustration that people have getting an appointment when you have to go to every single individual site and fill out a long form only to be told they have no appointments available. And then you have to go to another site and another site and another site. And it's very discouraging to people, particularly people that don't have access to digital, resources.
And that is a very important issue that you're highlighting, Brenda. It's an equity issue all around. And again, like I mentioned, for the city standpoint, from the health department standpoint, we recognize that these issues are ongoing and the frustration is very real, very understood, very necessary, and affirmed. However, recognize that because of vaccine supply, these will be issues that will be consistently encountered until there is a sort of steady flow in terms of the vaccines, right? And I think we've all in some way, shape, or form weathered different challenging times, and we know that these things they're cyclical, and then it will plateau at a point in time, right? So the point in time will come where vaccine readiness and vaccine appointments will be readily available, and hopefully will significantly decrease a lot of the frustration that New Yorkers are feeling in terms of being able to readily get vaccine appointments, right? So that point in time will come. And I know that the health department is doing its very best to help to streamline those operations and figure out how to make that happen. But very frankly, until the initial supply from the federal government and from the state allocations are rectified, until that becomes free flowing, these will be some challenges that will persist for a little while. And we apologize for that, and we recognize that.
Noah, the governor announced yesterday that the federal government would be setting up 2 vaccination sites in the city. Are registrations for those sites going to be available the same way, sort of through the city, or is the federal government going to operate its own?
Unsure yet. We haven't received guidance yet on that because that's still developing. All we know so far is starting February 15th, right? The eligibility criteria has been expanded for people with underlying conditions. Once those sites are set up, if it is something that becomes a New York State federal government partnership, and there's clarity around that, New York City will inform us. So we will have, the health department will have better understanding as to how people can go about getting the appointments for that. And if those appointments are available, it would be available via the vaccinefinder.nyc.gov site, right? So, but as of today, as of this morning so far, I do not yet have any guidance on that. We recognize that the state, New York State in and of itself, has many partnerships with the federal government, and they have their own reservation system. We've encountered people who've made appointments through that system that have had challenges in terms of being able to get their vaccination. So for the health department, for the New York City Health Department, we're just recommending right now that vaccinefinder.nyc.gov should be your main portal as much as possible until greater clarity is received about these new sites.
Okay, thank you.
Thank you.
We have a follow-up question, whether there's any known timeline for clergy to have appointments and whether clergy would ever be considered essential workers.
It's been something that has been elevated significantly by the multiple clergy that we work with as well, in terms of the need to designate clergy as frontline workers, essential workers, people who have been responding to this crisis since its advent. We do not know yet if that will be the case. Right? I'm sure we haven't yet received guidance about that, and we've been advocating for this. It's close to a year now, right? So we do not yet know if that will be the case. What we do know is that based on the differing tiers and the expanded eligibility criteria, as different things become available, if clergy fall into that, then they will take advantage of that. But the designation as essential workers, that even though it's been something that has been highlighted and is still being advocated for, we are yet to receive clarity and guidance on that.
Okay, that person just followed up to say that she knows clergy upstate who have been vaccinated without known health issues or of age, but I know as a representative of New York City Department of Health and Mental Hygiene that's probably out of your wheelhouse.
Indeed. I cannot speak to where or how they were able to do that. The hope is that they, in some way, shape, or form, met the current eligibility criteria. They fell into that eligibility criteria. But again, in terms of New York City for now, we haven't yet received any guidance on clergy being designated as essential workers, frontline staff. And the only thing we can advise right now is for clergy to ensure that they also meet the current eligibility criteria in order to be able to schedule appointments.
Okay, thank you. I also wanted to just follow up on what you had said about the pop-up mobile vaccination sites. Could you say a little bit more about that?
Right. So the governor's office has been working on its own accord. As you know, the state also has a number of different sites all across, and they've been working with. They've had a couple of partnerships with different faith-based organizations and cultural institutions in New York City, where essentially they're piloting being able to host pop-up vaccination sites, similar to what happened when the pandemic first hit, and they piloted hosting testing sites at faith-based organizations and non-clinical settings. So I believe that that's something that the governor's office has been doing. They've had a partnership with, I think, Abyssinian was one site, Christian Cultural Center. There are a couple of other sites in New York City, and I think the governor's office just announced another wave of different faith-based organizations and different institutions that they're using, generally non-clinical settings that they're using to host pop-up vaccination sites, right? And those things have very short timelines. They're there, appointments are limited, they vaccinate a certain amount of people, and that's it. And then there'll be another cycle where they'll be able to get some vaccines. And because this is something that's a pop-up, that information is not readily available. And again, it's generally managed through the state's office, the governor's office. So we do not necessarily have, you won't actually see those sites on vaccinefinder.nyc.gov to the best of my knowledge right now, right? So, but that's happening. And I think that's something being piloted. And like I mentioned, right, the time will come where we will reach that threshold, where things will plateau, where there will be more faith-based organization sites used as vaccination sites, similar to the ways in which faith-based institutions responded to becoming testing sites during the height of the pandemic, right? So I think that time will come where we will see that. We will see other non-clinical settings being used as vaccination sites in order to meet the vaccination efforts, right? Again, the caveat is keep in mind that all of those sites, both the pop-up, the current, and any other private sites that might be identified, all of those will still be subject to vaccine availability, right? And that is something that is beyond New York City's control. That's a federal issue.
Sure. Thank you. I just wanted to call your attention that the Interfaith Center had shared a link to a New York Times article about that, that vaccine finder, in case you or anybody else is interested in following up on that. And I want to make sure that there are no further questions before we wrap up. Is there any other pressing question that folks have for Noah during his time with us today?
Does anyone have any questions around the current eligibility? Any further concerns about the vaccine? Everyone is aware about the current eligibility, right? In terms of 65 and above, and then starting February 15th, anyone who has underlying conditions such as cancer, type 2 diabetes, it's a variety of things. They'll be currently eligible starting February 15th. All right.
That's great. I have a few, we're not getting any questions about the eligibility. We have a number of folks saying thank you. I have a few vaccine resources that we can go through before we wrap up the presentation in just a minute. And if you see anything as I go through these resources, Noah, that you want to call attention to, please stop me.
Sure.
So we included this flyer, what New Yorkers need to know about COVID-19 vaccines, as well as a link to the flyer. So you'll be able to access that when you have the copy of the presentation. And there's a separate flyer specifically designed for older New Yorkers, and it answers some of the questions that we have about being homebound and home care workers. We do have one follow-up question from Christian Granberg. For the 15th opening, did you say that the link opens on the 14th to make appointments? Is that correct, Noah?
Not sure, actually. The hope is that it should be open sometime very soon in order to be able to make appointments, but actually I'm not sure in terms of when they'll make that available. I think the plans are to make them readily available, but I'm not sure about the exact date.
Sure. The information we got from the state was the 14th, but I'm not sure if the city might be doing something differently.
Right.
And Susan shared that she got a question about what proof is needed for people with underlying conditions. That's a big one.
I think that there was a site shared or information shared about currently in terms of underlying conditions. It might be something as simple as getting just a note from your doctor that could, to prove that you have this underlying condition. I think that's generally something that would meet that criteria. I think there is some sort of fact sheet being developed about that as well, or some a link with some information. I will find that out, and if I can revert to you, and then you can then share with your members. But I think for now it's just some sort of medical note, right? Should suffice.
Okay, great. If you can follow up on that, that's really great information to have. Here we're sharing just a FAQ sheet also from DOHMH that's available for all of you. Some more resources where you can get info about the vaccines if you have further questions, resources for making an appointment. And we've already done our Q&A. So I just want to say thank you to all of you and remind you, if you're able to please fill out the evaluation. That really helps us to improve our content. And we'll send the video to you following completion of that. If you didn't attend today, or if someone you know didn't attend today and would like to access the video, there is an option in the evaluation to say, I didn't attend, but I'd still like the video. And please feel free to reach out to us if you have any follow-up questions, either for NIDIS or things that we need to forward along to DOHMH. And once more, I want to thank Noah for your help here today, for answering all of these tough questions, and Reverend Dr. Chloe Breyer and all of her colleagues at the Interfaith Center of New York for co-sponsoring, as well as the New York City Mayor's Center for Faith and Community Partnerships. It's been a pleasure to be with you today, and we really hope that this was informative and useful.
If I may just add, thank you so very much for all these questions. We know clearly that the efforts to effectively address this pandemic, testing, vaccination, and everything else after that, all those efforts have been informed and are informed by your questions, your opinions, your thoughts. So thank you very much for that. And the hope is that everything that you've elevated will help to streamline this process and eventually get New York City back to, or well adjusted to, our new normal. All right, thank you for having me.
It's our pleasure. Thank you, Noah. All right, take care, everybody, and have a lovely weekend.